Hi, I'm Sal Sclafani, the Medical Director for CCSVI at American Access Center Physicians. Last month, American Access Care sponsored a symposium lasting 3 days in New York City on CCSVI. The first day was a celebration of patients, educating and reveling in the quality and the magnificence of the patients. The second 2 days brought together the very best research throughout the world. American Access has developed a series of videos which we'll share with the community at large. We hope you enjoy the symposium and learn as much as I have. Thank you. Dr. Zamboni had some personal reasons to try to understand multiple sclerosis better. And in his own personal analysis and discovery process, he noted some similarities to disease that he had been treating his whole career. He is a vascular surgeon who has, his own disabilities that preclude him from doing surgery, and therefore has worked many years in a vascular laboratory. And it was by his, kind of fortuitously, that things came together for him, that he had a personal reason to look at this, and he also had some deep understandings of hemodynamics and vein pathology, and in his discoveries saw similarities between the pathology of multiple sclerosis and the pathology of chronic venous insufficiency of the lower extremities. And that led him on a course of evaluation and discovery that noted an association between multiple sclerosis and abnormalities of the outflow veins of the brain. And he postulates that this abnormality of the outflow of the brain leads to exuberant retrograde flow through collateral vessels, some of which end up in the deep cerebral veins and result in a flow overload of small veins, and that he postulates leads to loosening of tight junctions and diapedesis of red blood cells across the blood-brain barrier, leading to hemosiderin deposits, iron deposition, and inflammation of the brain. And the theory puts the demyelinization on the back end rather than the front end, and the autoimmunity as a response to dead tissue then, as opposed to the primary process. I don't want to try to get into it any deeper than that because I'm not Paolo Zamboni and I don't understand it all myself. From a personal point of view, I don't think it's important. And I think that Paolo made a mistake to make this association so strongly between the etiology of multiple sclerosis and the outflow obstructions of the vein. The outflow obstructions of the brain are, for anyone who has managed this process for any length of time, is clear-cut and overwhelming evidence that the veins are abnormal. And it's my postulate, not Zamboni's, but it's my postulate that some of the symptoms that we see in patients with multiple sclerosis are really the symptoms of outflow obstruction of the brain and not multiple sclerosis itself. That is one of the things that we will have to determine with time. But we're here today to try to wrangle that, because the rage has been an objection to the concept that venous obstruction can cause multiple sclerosis. But for the patients, the rage is that relieving the obstructions of the veins improves their quality of their life. So we have to reconcile that over the next 2 days.